to perform a treatment for humeral joint centration. Now you perform this treatment if the patient fails the joint centration assessment. And they'll fail, either they'll have anterior glide of the humerus, or they'll have pain with humeral internal rotation. So the patient's going to be in this position, and we're going to go over 3 separate ways that you can provide this treatment. There's many others. You can be creative as possible. But before we get into those 3 different ways, I first want to show you again a failed test. So the patient's going to first passively, I'll take them through internal rotation. Then they're actively going to internally rotate. And what you'll notice is the humerus is going to glide anterior and come back. The patient reports pain. Therapist comes in, can provide a posterior glide when they glide anterior, maintaining that stable position. Go ahead and rotate in and come back. The patient increases range of motion and decreases their pain. So that's a review of the test. That's actually also the treatment. That posterior glide, reducing symptoms, is going to allow the patient to go from late cocking into acceleration with less pain. So how do we have them do that on their own? I can't be with them on the field pressing into their humerus in the posterior direction. I can't even be with them at home while they go through their home exercise program. So there's a few things that you can do. The first thing, take a soda can. The really nice thing about a soda can is that the bottom of the can is rounded similar to the size of the humeral head. So you can take the soda can, you can place it on the anterior aspect of the humerus. You can have the patient apply a posterior direction with that soda can, and then go into humeral internal rotation while passively applying that humeral posterior glide. Now, first, I'm just going to show them how to apply the pressure. Go ahead and go into internal rotation, and then come back. Part of the reason that I show the patient first is because, as you notice, the more they go into internal rotation, you have to slightly angulate the capsule, you have to slightly angulate the soda can to align with the capsule. So go ahead and go into that position, apply that posterior glide, and then come on back. And then do that on your own. Also, by angulating the soda can, you're also not allowing the anterior delt to get in front of the humeral head. So you're making sure that you have a direct pressure on top of it. So that would be the treatment. The patient's going to passively posterior glide. The goal is to eliminate pain or symptoms, and also to regain range of motion. So a soda can is quite firm. It's a lot of pressure into a posterior glide. So this would be the first step that you would do.